I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respect to elders past and present. I'd also like to acknowledge and thank AbbVie for providing us with the funding to deliver this project. The focus of this webinar will be on fear of cancer recurrence. We have three incredible presenters who are going to share some valuable information with you. If you have a particular question, please call the Ovarian Cancer Australia Information and Support Line on 1300 660 334. This webinar is being recorded live and will be posted on the OCA website. If you're having trouble with the sound, you can dial the 1800 number listed in the chat box. So I'm extremely privileged to introduce our presenters to you. Our first presenter is Dr. Maria Ftanou. Dr. Ftanou is the head of the Clinical Psychology Department at the Peter MacCallum Cancer Centre in Melbourne and a research fellow at the School of Population and Global Health at the University of Melbourne. Maria has over 17 years of clinical experience, primarily in the field of psychosocial oncology. Dr. Ftanou will talk about what this anxiety around fear of recurrence is, when it may arise, and some techniques to help manage the fear. Our second presenter is Dr. Ben Smith. Dr. Smith is a postdoctoral fellow at the Centre for Oncology Education and Research Translation, the Ingham Institute and the University of New South Wales. Dr. Smith will talk about the latest research regarding the impact and management of fear of recurrence in people affected by ovarian cancer and cancer more generally. And our third presenter is Jan Anthony. Jan is a 74-year-old lady who was diagnosed with stage 3 ovarian cancer in 2008 and has survived despite the cancer returning 3 times. She's been cancer-free for the last 4.5 years and shares her experiences and thoughts on what works for her when the fears of recurrence surface. So I'd like to now hand over to our first speaker, Dr. Maria Ftanou.
Thank you, Vanessa, for the invitation. I'm delighted to be speaking to you today about fear of cancer recurrence and also to be speaking with Ben and Jan. So today, my talk's going to cover, we're going to look at what is fear of cancer recurrence. We're going to discuss some of the impacts that fear of cancer recurrence has on people's lives, and then we're going to look at some tools that may help better manage fear of cancer recurrence. So when treatment is over, there is an expectation for people to go home and start to feel positive and get back to normal. For many people, however, this is not the case. Of course, people are relieved that cancer and its cancer treatments are over and they don't have to go through the exhausting treatment regime. However, cancer has ongoing and lasting effects. So once you finish treatment, the cancer continues to impact on your physical recovery, on your identity. You've gone from being a well person to being unwell to now not quite sure which side to stand on. It impacts on your social networks and your ability to go back to work, on your intimate relationships. It causes fear of maybe perhaps life might not be as long as one had expected it to be. It impacts on your body image and on your emotions. People often feel once they're finished treatment, there is a sense of relief, but also they might also feel abandoned by their medical teams and not being monitored carefully anymore, and this causes anxiety about being left alone to manage after treatment and manage whether and monitoring your body. So people often feel a bit frightened at this point, and when they finish treatment, new thoughts start to emerge. At the beginning, the thoughts were like, let's get together and fight this and beat this and come and talk. At the end of treatment, people start to question whether they've done enough, whether the treatment has worked. So how long will the treatment work? Will they ever have to go through this again? And these kind of thoughts are often what leads to fear of cancer recurrence. Fear of cancer recurrence is one of the most common symptoms after finishing treatment. And fear of cancer recurrence has been defined as the fear or worry the cancer could return or progress in the same part or another part of the body. It affects both people with curative disease and people with more metastatic and progressive disease. It is one of the most common unmet needs in people with cancer, and by that we mean that people kind of say, we really need help with this, and we're not addressing it we're not addressing it adequately. So it continues to be a need. And then also this fear of cancer recurrence has also been found to be persistent in many people as well. So even there's studies that revealed that 1 in 3 people, even 10 years post-cancer diagnosis and treatment, often experience fear of cancer recurrence. This fear can take many different forms. Some people's fear is about being really worried that if the cancer comes back that they will die from it, and so they're fearing of death and how their death may impact on others or how they will die, will it be painful. For other people, it's about fear of further treatments, like not wanting to go through further chemotherapy, radiotherapy, and feeling all the side effects of these treatments, or worried that they'll be suffering from these treatments and feeling disabled by some of these treatments or loss of further independence. So that for other people, it's the fear of not being able to fulfill obligations, and that might be raising your children or fulfilling your commitments to your family and the ones you love. Fear of cancer recurrent, as I said, is quite prevalent. And it can range from mild to severe. The ranges, because of the way we've measured fear of cancer recurrence, are quite large, and our definitions of it in the literature. But in general, up to 97% of people have been found to experience a degree of fear of cancer recurrence. 22 to 87%, with an average of 50%, have been found to experience moderate to high levels of fear of cancer recurrence. From 0 to 15%, with an average of 10%, have been found to experience high levels of fear of cancer recurrence. The characteristics of fear of cancer recurrence manifests because people have a strong conviction that their cancer will definitely come back. It often involves constant and intrusive thoughts and worries and ruminations about the cancer. So you might be out with your family, your friends, doing something that you love, and there it pops in, and the thought pops in. It's, oh my gosh, it's going to come back, and it's intrusive and intrudes on all these on the special occasions. It intrudes in your sleep, and people develop a hypervigilance to physical symptoms. They're always on watch for a physical symptom or any changes in their body. For some people, fear of cancer recurrent leads to avoidance of medical appointments, screening, self-checking and monitoring. For others, it leads to excessive levels of symptom checking and screening. And by that, that might mean asking your physicians for increased scans, calling up your GP, having increased medical appointments to make sure that you're safe, and also increased naturopathic appointments as well. So at severe levels, fear of cancer recurrence interferes with your daily functioning. You're unable to concentrate. You're unable to do the things that you love. Spend time with your family and friends. You're not present to those interactions, and it is often associated with distress, increased levels of anxiety, increased levels of physical symptoms, depression, and a lower quality of life. There's lots of personal descriptions in the literature, and I'm sure that you'll have your own wording for what it feels like. But people often describe it as feeling stuck, feeling stuck, too scared to live and too scared to die, feeling that life has stalled, been put on hold, with no way of knowing how to get started or move forward again. That kind of constantly waiting for the shoe to either drop, for something bad to happen. And I like this last description that I've got on the screen, where you're worried about all the symptoms. It could be gas pain or it could be cancer. Some people are more at risk than others for experiencing fear of cancer recurrence, and people who are younger are more at risk because it's not something that they've expected to have in their life. Cancer is often experienced by people that are older. People with a past traumatic history or general levels of anxiety or anxiety disorders. If you've had some kind of past trauma, you're more attuned to look out for danger. Females are more likely to experience fear of cancer recurrence. And there's also people who irrespective of their level of risk, have a high subjective risk perception. They strongly believe that their cancer will come back. And if you've got ongoing physical symptoms or experiencing severe side effects, it's often a reminder that something else is going on in your body and often triggers fear of cancer recurrence. Another risk factor is being dissatisfied with your medical team and your treatment. This often leads to a fear of cancer recurrence because you often feel that you haven't gotten the best treatment for yourself, and you have to keep monitoring, and you feel that you're at risk. There are also some triggers that lead to fear of cancer recurrence that you need to be aware of. So around follow-up appointments and scans, it's often a time that I see people with increased levels of fear of cancer recurrence. If you've noticed a new or ongoing physical symptom, anniversary dates, often anxiety and fears peak because you're often taken back to the point of being first diagnosed. Every time you hear about a new celebrity's diagnosis or battle with cancer or a media story, it often triggers your own thoughts and fears and people's own experiences of cancer. People are very genuinely sharing their experiences of cancer and stories about cancer. And usually these stories are not stories that people do well in. And if you're often been hearing these stories, you're more likely to be triggered, and your own fears are often likely to be triggered. So, how do you live? How do you live better with fear of cancer recurrence? So our aim of our treatments and our toolbox is not to get rid of the fear. For some people, it is very likely that their cancer will come back. But what our aim of treatments and strategies, and Ben will talk later on about some of the more evidence-based treatments, it's about learning to live well with the fear and learning to manage it so it doesn't interfere with the things that you love to do and your relationship. So I love this quote by John Kabat-Zinn. You can't stop the waves from coming, but you can learn to surf. So our toolbox is about teaching you to surf. So the first step in learning to manage fear of cancer recurrence is to practice good self-care. And self-care is the intentional activities that you do on a daily basis to look after yourself, to take good care of yourself, to refuel. And it's not something to be added to a to-do list. It's a commitment that you make to yourself. And good self-care begins with investing in your supportive relationship. Seeing the people that you love, that you care about, that boost you, that fuel you, that inspire you, and avoiding the people in our lives, we've all got them, that we feel obligated to see or that, are quite negative around us. So avoid some of those interactions and invest more in the interactions and people that make you feel good and that you love being around. Looking after your physical health is very important, and I know that you've probably heard lots about exercise and nutrition. Exercise is hugely important, and the recommended levels of exercise are about 30 minutes a day, and exercise that leaves you a little bit breathless. So it's kind of been described, instead of taking your Chihuahua for a walk, taking your little German Shepherd, your German Shepherd for a walk. So it leaves you a little bit breathless. Good nutrition, making sure that you go to sleep when you're tired, wake up at the same time every day, practice good sleep hygiene, and invest in a good GP that is there willing to listen to your physical symptoms as well as your emotional symptoms. Another hugely important thing to do when you're looking after yourself is to really be aware and reflective about your own resources. After cancer treatment, you're exhausted and tired. You're going to need to be able to say no to some of those things you don't want to do and break down tasks to make them manageable and doable. If you want to don't clean out the whole house, clean out one bedroom, clean up one drawer, break tasks down. Find things that are meaningful and give you pleasure. It could be a walk in the park, it could be playing with your dog, it could be learning to sing or play a musical instrument, it could be spending time with people that you love. Find what is meaningful to you and do it frequently. Here are some activities that, just in case people, because we often stop doing the things we love when we're quite stressed, here are some activities that you might invest in. Doing gratitude lists, going out for a nice meal, spending time in the garden, Do what is meaningful and gives value to your life. Communication with your treating team is essential to managing your fear of cancer recurrence. You need to be clear with your treating teams about the kind of information that you'd like to receive and how you'd like to receive it. For some of us love information. Some of us feel empowered by information and we want lots of it. We want to know every single bit of detail. Ask for that information and tell your treating team that that is how you work best, with having this information at hand. For others, some of us don't like information at all. It makes us anxious and we feel overwhelmed. Tell your treating team that you don't like that much information and you need to only be told certain things. But good questions to ask your treating team. Ask them about what their surveillance recommendations are. How often should you be checking? How often should you have scans? How would these appointments be arranged? And then ask them questions of like, if you notice a symptom, how long do you need to wait before you do something about a symptom? Can you wait a week? Can you wait 2 days, or do you need to, or can you wait 2 weeks? What are the risks of waiting? Also ask your team about when you go for scans, how long will you need to wait for results? Is it normal to wait 2 weeks? Or will you get a call the next day? Or when will you get called in? Also find out from your treating team, who do you go to when you have questions about your physical symptoms, your side effects, if you notice something new into your body, do you go to your nurse? Do you go to your GP? Do you go to your medical oncologist? And what is the best way to communicate with them? Is it to call and leave a message with the receptionist and they will guarantee to get back to you? Or is it to send an email? And how quickly does your medical team get back to you? Do you have to wait 2 days, or do you have to wait, a week? What is the best way to get information? And if they're not available, who do you go to? What kind of questions do you go to your GP with, and what kind of questions do you go to your medical oncology team with, or your cancer team? You might have heard a lot about cognitive behaviour therapy, or it might be the very first time. But cognitive behaviour therapy is often used to explain fear of cancer recurrence and to help with the thinking around your thoughts that might exacerbate your fear of cancer recurrence. So this is the brief model of fear of cancer, a brief model of CBT. So what it basically, the model states is that your thoughts will impact on your feelings and behaviours and vice versa. So if you have a thought, oh my gosh, my cancer's come back or it's progressed, it's going to impact on how you feel and your behaviour. So my next slide will give you a bit of an example. So we start up the top here. If you've noticed a physical symptom and you've gone, oh my God, it's back, I'm not going to be able to handle this, this is a disaster. If that's the first thought you've had, you're going to end up feeling quite overwhelmed, anxious, scared. You're going to end up either checking your body or being hypervigilant, or going, I'm going to avoid this and not do anything about it. But whatever these behaviours that you choose to do at that point, it's probably going to leave you a bit breathless, shortness of breath and anxious, and you're probably going to experience more muscle tension, and it's going to become a little bit of a vicious circle. Other thoughts that often get us in trouble with fear of cancer recurrence are our thoughts about worry in itself. Many of us have a relationship with our worrying thoughts. So some of us believe that if we worry and we get told, and we get told that our cancer has progressed or reoccurred, that we'll be better prepared to manage it. In my experience, working with people with cancer for quite a number of years now, people, even if the news is bad, people are never prepared for it. You react in a different way. So a rule about worry is worry when you can do something about it. If you can change something, then worry about it. For other people, they have relationships with worry that exacerbates fear of cancer recurrence, in that they believe that worry is harmful or making them sick. And so they start, as soon as they notice a worrying thought, they start panicking about it, because they believe that they are creating their cancer to return, or fulfilling a self-fulfilling prophecy that now they're going to make their cancer come back. There is no evidence that worry in itself causes your cancer to come back or return or progress, but it does make you feel very stressed and uncomfortable. So what can we do about worrying thoughts? We can start to reframe them. And some good questions to ask yourself when you're getting into that spiral is, are you confusing a thought with a fact? Are you predicting the worst possible situation, jumping to a conclusion? Are you minimizing any of the positives that are happening right now? What are the advantages of you continuing to think that your cancer's coming back? Are there any disadvantages to these kind of thoughts? Are you only paying attention to the dark side of things at this point because you've gotten caught up in this ruminative thinking? And the one I really love there, if a friend was going through these kind of thinking at the moment, what would you say to them? And try and apply that kind of thinking to yourself. Another way that you can deal with some of these ruminations and thoughts is through practicing acceptance. Accepting that you have these thoughts and feelings at the moment, and then you're feeling quite anxious and you're feeling, and the thoughts are running through your mind, but knowing that these thoughts will pass too, and these feelings will also pass. So don't judge them, just label them perhaps and say, oh, I'm experiencing these fear of cancer recurrent thoughts again, and they're intrusive. So you could label them, but not get caught up in them. And some useful metaphors to kind of think of it is like clouds in the sky. So imagine your thoughts like clouds in the sky that are going to pass over soon. They might stick around a bit longer than you're comfortable with, but they will pass. Or think of your thoughts as that you're a passenger at Flinders Street Station and you're watching the trains go by, and they're your fear of cancer recurrence thoughts. You don't have to hop on those trains. You can just watch them and wait for the thought you want to hop on and invest in that. You don't have to get caught up with those thoughts. Or again, another one is imagining your thoughts as leaves on a river stream floating by. You can just watch your thoughts go by and not get engaged with them. Mindfulness is another very useful strategy to help with managing fear of cancer recurrence. And by mindfulness, mindfulness has been defined as the mean as paying attention in a particular way on purpose and being in the present moment and not being judgmental, being kind of just noticing what's going on and not being judgmental about yourself, your thoughts and your feelings. So a usual technique with mindfulness is to focus on a particular object, to train your mind perhaps to focus on your breath or sound. But we traditionally focus on the breath because the breath is aware of how we're feeling a lot of the time. So that's why we tend to focus on the breath. When we're excited, our breath changes. When we're sad, our breath changes again when we're angry. So that's why we focus on the breath, because it's really connected to our emotions. So when you practice mindfulness, you'll do lots of breathing exercises, and your mind will often wander. And to bring it back to the present moment, you've got to bring it back to the breath. You do this once, you do this twice. You might be required to bring your mind back to the breath 1,000. Your mind might travel from the breath 1,000 times, and 1,001 times you need to bring your mind back to the breath. So this kind of mind training helps you to be in the present moment, to be more responsive rather than reactive to situations. And there are lots of mindfulness groups around Melbourne and apps that you can, in Australia, that you can use. One of the ones I highly recommend to people is the Open Ground. The Open Ground classes, and they do them online, and they also do them face-to-face, and they're across Australia. And another good mindfulness website and app is the Smiling Mind one. And I've got those links down the bottom of that slide. It is also, to manage your fear of cancer recurrence, is to stay focused on the task at hand, being present at what you're doing in the moment, and not not going too far ahead. And I love this quote by Jimmy Holland, and I'm just going to read that out for you. The diagnosis of cancer and its treatments creates a sense of urgency about time that goes along with the uncertainty it causes. However, the person who can say, I'm just going to take it one day at a time, is able to stay focused on the task of the day. The person who hardly enjoys today because of concerns and worries about tomorrow has a much harder time dealing with the illness. Hard as it is to keep thinking that way, coping with cancer is easier if you try not to focus on all the challenges that may lay ahead, but rather stay focused on today, during which you can accomplish something despite the problems. And just if some of us, if you're really struggling, might need some professional help. So speak with your GP, attend support groups like this, speak to your oncologist, and seek referrals to a psychologist. And this is the APS website and link, and you can find psychologists on this site from across Australia. So I always love to end with this slide because it's a little bit fun, but it also tells us a little bit about some commandments of how to look after yourself, and everyone should print them out and stick them on their fridge, and it's about really taking care of yourself. So the first commandment is try not to be perfect. Don't even try. You shall not be perfect. Try not to be all things to all people. Leave things undone that ought to be done. Try not to spread yourself too thin. Learn to say no. Schedule time for yourself. Switch off and do nothing regularly. Be boring, untidy, inelegant, and unattractive at times. Try not to feel guilty, and especially don't be your own worst enemy, but try and be compassionate and kind and be your own best friend. Thank you for listening to me today, and I hope you found some useful tools that you will use for managing your own fear of cancer recurrence. Handing over to Vanessa now.
Thank you so much, Dr. Ftanou, for providing us with that valuable information. It's much appreciated. We've just got one question for you. What can I do to manage my surge of fear in the moment? You should.
I think it's when you notice that surge of fear come on, I think it's about stopping and noticing it and just labeling it. It's saying, oh, I've noticed that I'm experiencing this fear, and thinking about it and not reacting to it, not trying to get caught up in it, and thinking about perhaps using one of those metaphors that I described earlier about watching your thoughts float in the cloud like a cloud that it's going, this thought too will pass, or this fear will not last, and I'll be able to cope again. Just noticing the symptoms. Thank you.
Great. Thank you very much. Thanks again for joining us on this webinar.